Hi, everyone. Welcome to the second episode of the Fulbrighter podcast. Fulbrighter is an exclusive networking platform for Fulbright alumni and grantees. The platform lets you keep up to date with news from the global community of Fulbrighters and connect with fellow alumni and grantees from around the world. If you are a current grantee or an alumni from an official Fulbright program, head to fulbrighternetwork.com to create your account. My name is Gabriela Jimenez, and I'm a journalist and the community manager for the Fulbrighter platform. Today, I will have a conversation with Jeffrey Lesser. Jeffrey is a Samuel Candler Dobbs Professor of History at Emory University. His research focuses on the relationships between immigration, ethnicity, and national identity. His new book, Living and Dying in São Paulo, Immigrants, Health, and the Built Environment in Brazil, has just been published in the U.S. by Duke University Press and in Brazil by Editora UNESP. Jeffrey's latest book focuses in Bom Retiro, a multi-ethnic working-class neighborhood in the city of São Paulo, to analyze how the state creates and enacts health policies. And he asks why different immigrant groups often generate similar responses to state actions. Lesser is also the author of a number of prize-winning books published in English, Portuguese, Japanese, and Hebrew, and he is the winner of multiple teaching awards. He has also won national and international fellowships from Fulbright, Fulbright-Hays, the Social Science Research Council, the Ford Foundation, the National Endowment for the Humanities, and the American Council of Learned Societies. Research for Living and Dying was supported by fellowships from the Fulbright Scholar Program, the University of São Paulo, Institute for Advanced Studies, and Emory University's Global Health Institute, University Research Council, and Interdisciplinary Faculty Fellowship Program. So there's a lot of people supporting this research. I also want to remind everyone that Fulbright Awards are available across the globe. So you have time to apply for an award in Brazil or elsewhere. Just make sure to head to the Commission's websites and search for the best award for you. Hi, Jeffrey. It is such a pleasure to have you on our podcast.
Good morning.
Good morning. So I have to say, I have read your book, and I'm really eager to discuss it in detail. But first, can you tell us a little bit more about how you ended up specializing in Latin American studies? When did this connection begin?
Yes, when I was in college, the first professor I met who inspired me was a professor of Latin American studies. So I wasn't, it wasn't anything about Latin America particularly. It was more like meeting a professor who became a mentor. I grew up in a very small town and went to a tiny rural public high school. So going to college for me was an unbelievable experience. And that professor kind of got me interested, and I went from there.
That sounds great. As I understand, you have participated in the Fulbright program 3 times. So I was wondering, how did Fulbright first come into your life, and also what was the importance of Fulbright Awards for your research and for your career?
When I was in graduate school, I first learned about Fulbright, which was one of the major grants that all the PhD students studying Latin America wanted. Um, I didn't make it that time. I was rejected, but I got another grant, so everything worked out fine. And as soon as I got my PhD and my first job, I applied again for another Fulbright to go to Brazil and transform my doctoral dissertation into a book. And so that was my first Fulbright. This was probably in the 1990s, I think. It was a long time ago. And it was an incredible experience for me because not only did I get to do my research and write my book and all those things, but unlike the grant I had had in graduate school from another foundation, for Fulbright, it was the first time where there was a community. And so I got the chance that year to, I'm trying to remember where we went. I think we all met in Rio, all the Fulbright fellows, not just in Brazil. I think they were from Brazil, Argentina, and Uruguay, all met together. Um, I met people from all different kinds of disciplines, which was incredible for me. Um, and then and then as the years went by, I continued applying for Fulbrights. Um, so I got another Fulbright to come to Brazil when I was working on my second book. And then I got a Fulbright Distinguished Chair to Tel Aviv University when I was working on my third book. And that was also a really interesting experience because that Fulbright, I was writing a book. I wasn't doing the research. And they have a huge Latin American Studies Center at Tel Aviv University. And so it was interesting for me to be in this kind of similar yet different academic atmosphere and sharing chapters of the manuscript and everything. And then most recently, had a Fulbright here in Brazil again, um, to finish this book that we're talking about today, Living and Dying in Sao Paulo. And this was also an incredible experience because I did it at a university that doesn't have a lot of Fulbright fellows. It's a university that um, is relatively recently formed. It's in a peripheral area. It's not even in Sao Paulo City. It's in another city in the periphery of that city. It's primarily for first generation college students. And so the experience was fascinating in that regard. And as is always the case, Fulbright does such a great job of bringing people together. So even when I'm not here on a Fulbright, like now, the people from Fulbright contact me and say, "Oh, Jeff, would you meet with so and so who's a Fulbrighter here? Invite so and so." And that's wonderful.
Yes, that is wonderful. And I think, that's why we have the Fulbrighter Network platform. And that's why we have this podcast, because I think a big piece of this program is community, right? And how we can bring people together. So that's definitely what also my experience working with the Fulbrighter platform has been. So I'm glad to hear it from you as well. So I have a lot of questions for your book, which I read very quickly last night. And I have to tell you that I thought it was fantastic. It's great writing, and it was a very interesting story that you're telling there. So I thought it was quite funny the way you start the book. And so maybe we can talk a little bit about that, because your book starts with a very peculiar tale about when you had to get rid of a gun that your in-laws had inherited somehow, and the whole process of contacting Brazilian law enforcement in order to follow the correct procedure. For those who are listening and are not aware, guns are not allowed to be purchased in Brazil without permits. So um, can you tell
Mhm.
our listeners a little bit about that, and how especially how that connects as well to the overall context of your book?
Sure. So, uh, the I mean, the story briefly is that one day I found a revolver in one of the drawers of my in-laws, which was a kind of, no one understood what this revolver was doing there. My in-laws are both refugees from Europe to Brazil. They're refugees from Nazism. They're very law-abiding people. And and so we had this gun, we found this gun, and immediately we were like, we've got to get get rid of this. We can't have this in our house. It's not safe. I think probably, I think our kids were probably at that point old enough to know not to play with a gun, but it was still kind of terrifying. And so we embarked on this, what turned out to be rather complicated experience of getting rid of the gun legally. And the the way it connected with the book was that in getting rid of the gun, I spent basically a day with the police talking, who were curious. I mean, who were asking me, why are you in Brazil? And I would tell them, I'm doing this research and about this topic. And then they would tell me stories about their own healthcare experiences, about their own experiences with immigrants. And so it kind of all somehow became part of the story of the book, especially after I eventually got rid of the gun and the police inspector very kindly drove me to my research site. And so I had this kind of weird experience of immigrating into this neighborhood where I do the research uh,
Wow.
for it. For the listeners, just to know, the gun turned out not to be a gun. The gun turned out to be a starter's pistol, which was like the funniest part of the whole thing, that we were completely panicked about something that couldn't shoot any bullets. And it turned out to be something like my father-in-law had bought for when my wife and her brother were children and they do running races and he'd hold the gun and, make the noise. But since I didn't know very much about guns, I assumed it was real.
Wow.
And I made $25 selling the gun, which was also really nice.
I was reading and I was hoping you would disclose at some point how much they gave you for the gun because that was also kind of a curiosity for me.
Yeah, I think at the time it was $25. I think.
Yeah, that's what you say on the book. So I also have to say, I was very personally touched while reading your book because my own grandparents have emigrated from Spain, and they spent time in this working class neighborhoods in São Paulo, living in the cortiços, which you've translated as beehives. So, for me, it was very moving to kind of read it and also imagine what it must have been like for them, right? So, could you tell us a little bit more about cortiços specifically, and how this housing model has impacted overall health over the decades in the city of São Paulo?
My research takes place in a neighborhood of Sao Paulo, but my argument is that this neighborhood is like a lot of other places, right? I don't think of the neighborhood as exotic or unique. It's the contrary of that. The argument is that what we can see in this neighborhood, Barcelona, and we can see Atlanta, and we can see Toronto in this. The neighborhood, which is called Bom Retiro, which means good retreat, like it was a place of leisure back in the day, is the primary focus of labor in this neighborhood is the textile industry. And it's been that way since the end of the 19th century. So it's been like this for a long time. And most of the people who live in the neighborhood have some relationship to the textile industry. They might be sewing clothes, they might be transporting clothes, they might be selling in shops or whatever. And they make very little money. They're usually paid as piece workers, right? So they don't have salaries and all those other things. They get paid by how quickly they produce. And they live in very precarious conditions. And these are called cortiços, which might be something like tenements in English, but I'm not sure if that's the right term. And it's been that way also for the last 150 years. And basically what a cortizo is a housing arrangement in which either each family lives in one room, and that room is everything. That room is the kitchen, the living room, the family room, the dining room, the bedroom. Or families live in groups where they might sleep in private rooms as a family, tiny little rooms, and then there are common areas that are for the bathroom, eating, cooking, etc. Most places like this don't have what in the United States we think of as a family room because the leisure parts of people's lives is very minimal. People work a lot. And the other interesting thing about it is in many cortizos, they're also textile workshops. So people literally roll out of bed in the morning and right there is a sewing machine and they get to work. And so one of the things that was very impressive to me was that this kind of housing had continues today, um, even though maybe we think of it as something from the 19th century. And this was an important part of the argument of the book that when these housing forms maintain over time, certain kinds of health issues maintain over time. So for example, in Bom Retiro, in spite of all sorts of biomedical advances, there's still lots of tuberculosis. There's still lots of mosquito-borne diseases because there's garbage in the streets and water gets picked up in the garbage. And so for me, the book is really about how things don't change, not as much about how things do change.
Yes, I think you make that argument. For me, as somebody who comes from São Paulo, it was quite interesting to think about how the things have endured. Right? We often think that we've come through a lot, but there are things that have endured, and I think this very poor housing situation is one of them. So, Jeffrey, your book also mentions the Brazilian public healthcare system, which is called SUS by Brazilians, and which, by the way, I think it's a big source of pride for a lot of Brazilians, but also it's a big source of a lot of complaints, right? So there's a lot of, I think, a big love and hate relationship with the public healthcare system, which is, I think interesting in the way that it's free for everybody, right? Regardless of citizenship. But I was also interested in the fact that, at the same time you have this big healthcare system that is available for everybody, you have, basic sanitation needs that are not being met, right? So I would love to hear a little bit more about, your thoughts on how, a big health system like this one that, could be really good, can become less effective when investments are not made in other areas, such as housing, basic sanitation, because it's almost like the state, in one side is providing healthcare, but on the other side, it's not providing basic sanitation. So it's kind of inflicting damage on its own healthcare program. So can you tell us a little bit more about that and how you found that while you were doing your research?
Sure. So for people who aren't from Brazil who are listening to this, and certainly for me as somebody from the United States, the Brazilian national health care system is a miracle. It's incredible that you can get your your healthcare needs met without having to have a lot of money or other things. One of the challenges, and we saw this very clearly in this neighborhood, Bom Retiro, is that the state is many things. And so the same state that, for example, doesn't do a good job of collecting garbage or doesn't do a good job of repairing the sidewalks is also the state that's taking care of people's health so effectively. In the neighborhood where I'm doing the research, about 80% of the population gets their health care from the national health system. And it's incredible in the sense that people can get vaccinated for free. It's funny, I decided as part of the research that I would join SUS and get my health care through SUS here in Brazil. Uh, it seemed to me that as a researcher, it would be weird for me to talk to people about their healthcare experiences without having my own experience with it. And it went really well. I mean, I continued to have healthcare from SUS, and actually even had a funny experience. Just 2 weeks ago, my physician in the United States wrote to me and said, "I'm concerned about whether you'll be able to get vaccinations in the United States anymore. Go get them in Brazil." And so last week I had my flu shot and my COVID shot here with my very, upper middle class physician, Emory paid healthcare person kind of expressing concern that in the United States, even with insurance, if my basic healthcare needs could be met, right? So that's part of I think the conflict in the book is between these different parts of the state. And I even tell in one part of the book a story about going to a kind of huge cortizo workshop one day with people from the health vigilance part of the health system, which was looking for mosquitoes. This was during Zika, in which people didn't even allow them in the building, right? And so that's one state. And then the next day, going with my medical team from the local health clinic and being welcomed in the building. So I think people understand that the state isn't one thing, that parts of the state really care about their health and parts of the state aren't doing their job. And you're right. I mean, it's unfortunate because, for example, you mentioned litter pickup. I mean, litter, in addition to being ugly and all that other stuff and making it difficult to walk on sidewalks, but the amount of unpicked up litter in this neighborhood makes it one of the places with the highest rates of mosquito-borne diseases because it rains in the junk on the streets, the little pools of water become mosquito breeding grounds, and people get sick. And the litter should be picked up, right? I mean, the litter is it's not just dumped anywhere. It's comes out of workshops and is more or less put properly on the street. But when it doesn't get picked up, dogs get inside and rip up the bags and all of those things. But the Brazilian healthcare system for me is a miracle. I mean, it's incredible that, at least here in Sao Paulo, you can go to one of the best cancer hospitals in the world and not pay a penny, right? That I can just walk into a place and say, "Here's my card, I need my vaccines," and they'll say, "Of course." Uh, and that I think for someone from the United States is is jaw-dropping. My team always finds it, the first time they come to Brazil, incredible that there's a country in which nobody asks, "Are you legally in the country or not legally in the country?" Like, it's really, for me, interesting and shows that states can do good things, if they commit to it.
Absolutely. And, I think most Brazilians, they're quite proud of SUS, but I do agree as well with your argument that, unfortunately, there are other things that are impacting how they perceive even SUS itself, right? Because it's all one state. So even though, it's different parts of the state, it's kind of coming from the same government. So I wanted to jump into something that caught my attention as well in your book, because one of the arguments you make is that geographic centers are often health peripheries, right? That was a sentence that really caught my attention. And I was wondering, can you explain a little bit more about that and why you believe that happens? Why is that so?
Sure. So one of the phenomena in the Americas over the last couple of hundred years is that city centers have gone from being the places where the elite live to the places where the middle classes and upwards don't want to live. And so the centers of the city often become, it's not that they become depopulated, but they become populated more and more with working class people, poor people, unhoused people, people who have different kinds of challenges. And because of that, the kinds of health problems in center cities aren't the same as the kind of health problems that you have in what in the United States might be called suburbs, but in Brazil would be called like the nice neighborhoods of the city. And they're often very close to each other, right? They're not far. So the health challenges are different and how healthcare works is different. And that's in part because in elite neighborhoods, at least here in Sao Paulo, many people have private health insurance. The health challenges they have are ones that are quite attuned to biomedical solutions. Whereas in the center, everything is being done by the SUS. There are parts of the population who have no regular health care at all. So, for example, in this neighborhood where we do our research, there was until very recently a huge part of the neighborhood that was like a multi-block cracked-in, right? So, you know, hundreds or maybe even thousands of people with serious drug addiction illnesses. And so what that means is that the centers of the city are often kind of targeted or seen as places of really bad health, as places that are scary, and as places where the state doesn't expect health outcomes to be as good as in other places. And you see that in all sorts of different ways. When I joined the SUS, when I signed up for the SUS, I had a really interesting and telling experience. In Bom Retiro, the way you prove your residence to become a member of the SUS is a community health agent goes to where you live and looks at you and says, okay, you live there. That's your residence. So when I went to prove my residence at my local health clinic, and I live in an elite neighborhood, I went there and I said, I want to sign up. And the woman said, what's the proof of your residence? And I said, oh, here's my address. Just send the community health agent over. You'll see that I'm there. And she was like, no, that's not how it works. We need your internet bill or your something. And it took me a few weeks to kind of negotiate that I actually had a residence here because I didn't have those things like all immigrants, right? Like all of these things were in my wife's name or in my mother-in-law's name. They weren't in my name. And so I thought to myself, wow, it's incredible. Here, the health clinic is actually creating a barrier to me becoming part of the SUS, in part because they assume somebody who lives in a place like I do has private health insurance. Whereas in Bom Retiro, it's exactly the opposite, right? They're using systems to get as many people in there. But that also means the lines are longer, right? So one thing that makes the center of Sao Paulo a health periphery is time is very complicated because people have to wait a lot to get an appointment. And unlike a person who has a a kind of middle or upper middle class profession. If you work in the textile industry, if you don't work, you don't get paid, right? So often we talk to people who describe their experience not as I had to wait an hour to see the doctor, but I lost this amount of money waiting to see the doctor, right? There's a very clear calculation, which like a university professor would never think like that, right? They would never think I lost money. They would say, I've wasted my time, my precious time, right? So you really see the distinction between the center city and the health challenges there and the other parts of the city where they don't have them. And so it's, as you say, it's this funny idea that the center is the periphery, right? The periphery in terms of health outcomes and health access is actually the center.
Yeah, I think that that makes a lot of sense, and that's definitely, I think, my experience in a lot of places. To go back to your argument that one thing is kind of reflecting many other things. Um, so you talk, this book is kind of looking back at the history of immigration as well, and you talk about how immigrants were often or are often characterized by several spheres of society as bad health vectors, right? When in fact, what most likely happens is that they are less likely to have access to sanitation, treatments, medicines, and are more likely to be subject to pollution, from factories or poor living conditions, for instance. Would you say this is the case worldwide? Is this a Sao Paulo reality, a Brazilian reality, or is it like a global reality?
I think it's primarily a global reality. Obviously, there's a scale, but I think even in, I don't know, what we think of as very wealthy places like Scandinavia or Western Europe, when you spend time in immigrant neighborhoods, you see the distinction. So the leveling is problematic in every country. And that you're right, that's part of my argument is that even if Sao Paulo in certain ways might seem extreme, it's not as extreme as you would think. And the phenomena that's happening, you can find everywhere. And my guess is that there are, not my guess, I know there are lots of countries where it's much worse. In other words, Brazil has SUS, right? I mean, this neighborhood, it's tough in this neighborhood, but there is a health clinic with doctors and nurses and health agents whose job and who can care about trying to provide as best they can for the neighborhood. In Atlanta, where I live in the United States, for example, there's almost nothing like that because there's no national health service. So poor neighborhoods are really, 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 really have problems with health outcomes because there are no doctors there. No people don't have insurance or all of those kind of things. I once spent a little bit of time on a observing a project in Ethiopia, in rural Ethiopia, where there is no medical care whatsoever, and in which the problems are things like where the animals live and where people live are the same spaces. And so there's all sorts of transference of diseases between waste and consumption and things like that, right? So even though Brazil like seems complicated, there's definitely worse in the world. I mean, my main argument is that there are all sorts of small things that might be able to happen in healthcare that would improve outcomes notably. And those are things like training healthcare workers to think about different cultures as part of understanding people's health. So, for example, in Bom Retiro, I mean, you have people from today, Bolivia, Paraguay, Korea, China, Bangladesh. And how you speak to people is different depending on where they're from. What they understand as appropriate behavior changes. The remedies that people learn about at home are different. I think someplace in the book, I say my grandmother always taught me when I was sick, you have chicken soup and bourbon. But now I spent a lot of time in Korea doing research. In Korea, that's not what it is. It's ginseng extract. And if you don't understand that as a healthcare professional, that people believe those things, I believe those things, right? That you don't do as good a job as you can. The physician that I work with at the healthcare clinic, whose team I'm on, he always says that if he were the minister of health, the first thing he would do is hire historians and anthropologists and sociologists to kind of think about the center of the city and the different kinds of people and how to better have a relationship rather than just what you learn in a medical school and then imparting it. And so that's pretty clear to me.
Yeah, and I think, we've been talking a lot about, the immigration, and, all the different immigrants that you can find in Bom Retiro today, but that you could also find in a different time, different, people from different places than the ones that are currently there. So it kind of continues to be painted and known as, an immigrant neighborhood or an immigrant area. But I really appreciated how, your work also touches on how Black and Brown Brazilians have been an important part of the neighborhood history, but the general sense that has been created in the Brazilian imaginary is that, of an immigrant neighborhood, which overlooks the fact that Black families had been present there for a long time as well. So, can you expand a little bit on that? Because I think, that's also a very important thing to discuss because there has been so few mentions of that historical presence that I've seen before.
Yes. So this is another way that I think of Bom Retiro as typical, at least of the Americas. Because New York City, of course, before the Europeans showed up, had indigenous people. And after the Europeans showed up, the English, most of the work was done by people from Africa or of African descent, right? It's only in the 1850s when you start to have people from Italy or Ireland or Poland or whatever coming. And so one of the things I really try to emphasize is that when we use the language of an immigrant neighborhood, we kind of give the impression that most people in these neighborhoods are foreign and have always been foreign. But that's not actually true. That in Bohachiro and every neighborhood in central Sao Paulo and every neighborhood in central Rio and in central Porto Alegre and in central Toronto, it doesn't matter where you choose. What you had was first an indigenous population, which then gets pushed out with colonization. And the colonizers are using in the Americas primarily enslaved people to do all the work. And that when slavery is abolished, that didn't abolish racism. I mean, it abolished a kind of a labor system, but it didn't abolish a cultural system. And so immigrants, I'm not saying purposely, but immigrants became part of the expulsion of people of African descent from the center of the city in Sao Paulo, but in many other places as well. And so that every time like somebody says to me, "Oh, Bohachiro, so cool. It's a Korean neighborhood." And I always say, "No, it's a Brazilian neighborhood." the majority of people who live in this neighborhood have always been Brazilians. The majority has never been foreign. And there are all sorts of people there who you never see. So, like, one of the things I do is I take people on walking tours of this neighborhood, and they're always shocked because I take them in a direction in which we start with part of the neighborhood that's been a comunidade, what used to be called a favela, and then a place where there's a samba school and all sorts of things, because what they think they're going to see is a Korean restaurant next to, I don't know, Chinese restaurant. And there's parts of neighborhoods like that, but that's not the majority of the neighborhood. And so for me, the question of racism is very strong when we think about immigration and health, because part of what happens in central neighborhoods is that many authorities have racist ideas about this, right? Like when people say, "Oh, it's dangerous, it's dirty." Um, these are ideas that aren't just based on some kind of statistical analysis of crime. They're also based on assumptions that the people who live in this neighborhood are less than typical. And those are assumptions that come from before immigrants came, right? That many of the assumptions about immigrants were the same things that were said about Black people before that. And that's really evident when you do the historical research.
And to touch on that, there are a lot of mentions in the book as well about São Paulo's intersection of health services and police, right? There was a medical police, but other forms of state control as well and repression that are often associated with, health services. So I wanted you to explain a little bit of why this is possibly problematic and if it's possible to determine that non-forceful health policies could be more effective.
Mm. So historically, the state wanted people to be healthy because they wanted people to be able to work, right? Not because they wanted them to be healthy as humans, but because they wanted people in the factories and other places working. And so, in that regard, keeping people at work in the factories for their health wasn't that different than keeping people at work in the factories, but not by not going on strike, not being politically active. And so, for a very long time, uh, in Sao Paulo and in many places in the Americas, what you had were the police, like we think of them today, but health was also done by something called police as well. And this isn't just the Americas. I mean, this, for example, medical police, I think started in France, right? That's what the first instant of it in, I think, the 18th century. I don't remember exactly. At certain times, the actual ministries in Brazil were called things like the Ministry of Police and Health, right? That was one organization, right? Even though today we think of them as very different. And for about 40 years here in Sao Paulo, there was an institution called the Medical Police. And the medical police were physicians based in the police department. And basically, when healthcare issues happened on the street, they determined not only what to do in terms of health, but whether the person should be sent to a kind of incarceral situation. And so the medical police have these incredible records, right? Like hundreds of thousands of records that, and we did like an analysis. So we took the records from the neighborhood and all this. And we kept finding things like the person would go to the police because something had happened and their health problem would be solved, but then they'd be sent to jail, right? Because of some other kind of thing. And I think with people's fears about security, the connection of policing and health kind of continues to be strong in Brazil. So for example, SUS health posts are guarded and have gates, right? So, like, if you didn't know what it was, it could be something different. You have a lot of concerns. Just last week at the health clinic, there was a situation in which a person who has mental illness was acting in ways that were bothering other patients. And some of those patients started threatening the person. And so the protocol in that case in the health clinic was call the cops, right? And that's a kind of a contemporary example of where you see that connection between uh, policing and health. And of course, police are on the streets, right? So I don't, I mean, I've never done research on the police, but I've dealt with police. And many of them who I've dealt with are fantastic, right? Like, if there's a person who faints on the street, they really want to help them and do the right thing, right? But what it does is it kind of suggests that the street is for the police and the clinic is for health. And how you get the person from the street to the clinic is exactly what puts the police and the healthcare workers into the same basket, let's say.
One of the many complications that you lay out in your book. The other thing that I was wondering if you could tell us a little bit about is, I was reading about the Spanish flu. That's something you also discuss in your book that hit São Paulo in the early 1900s, and many places in the world as well. And that kind of made me think of the parallels of that epidemic to, the COVID-19 epidemic. Can you talk a little bit about that? Did you also find that there were parallels between both pandemics?
Absolutely. All of these kind of health outbreaks have certain connections. So in the book, what I'm trying to do is argue that the bubonic plague from the 19th century, the flu from the 20th century, and to some extent COVID in the 21st century have similarities. One of the similarities is the connection to immigrants. So the flu, as you said, was called the Spanish flu. Another connection that was really interesting to me was that in the flu of 1918 and in COVID, neighborhoods in center cities, because of all the things we've talked about so far, like work conditions, housing conditions, uh, street conditions, had much higher rates of both illness and death than more elite neighborhoods, right? And so sometimes there's a kind of an idea that illness is democratic, like, you just get sick. But I argue that that's not really true, that where you live and how much money you make and what your job is have a real connection to illness. So that was another really clear connection to me. And then the other interesting connection is, how do people react to these illnesses? And in the 1918 flu, just like in COVID, you have the belief that emerges in kind of miracle cures, right? So it's incredible to read newspapers from Sao Paulo in 1918. It was like, oh my God, they're also talking about some crazy thing that will, cure you from the illness, just like happened in COVID. Um, you have the growth of miraculous stories of survival. And so, like, one of the things I talk about in the book is how in 1918, Bom Retiro became the center of people dying and coming back to life. And if you look in COVID, there are all sorts of stories like that. The person is about to die. Uh, the family takes them home from the hospital, and then they get cured, right? So, like, the hospital is the bad part of the story. They're going to die in the hospital, but the person is brought home and they come back to life. And so, on the one hand, that since I did a lot of the research and writing during COVID, that made me feel better, like, to remember that, okay, we've been through this before and we'll get through it. But then part of me was like, oh my God, all they need to do is read a history book and, they can find out if you don't use a mask, you might get sicker than if you do use a mask. If you don't take your vaccine, whatever. But that part also didn't change. One way that Brazil was really different during COVID than much of the world was having to do with SUS and vaccines. The vaccine rates during COVID here were very, very high. And I remember we were kind of prohibited from doing research overseas at our university, all universities in the United States. And I remember writing to the provost, begging him. I was like, please let me take my team to Sao Paulo. We can't get vaccinated here. Everybody's sick. There, we can get off the airplane and go right. We can be vaccinated within 3 hours of landing in the city. People are wearing masks, and so that is something different where you see the SUS and its culture of kind of basic healthcare having an effect that in a place like the United States, which supposedly has such elegant healthcare, but in which people don't believe certain healthcare things. And again, we see this so clearly today because our own Secretary of Health is a healthcare skeptic, right? It's like that story I told you. I mean, imagine a physician in the United States telling a professor with great healthcare, you might get your vaccine, get your vaccine in Brazil because you can't get it here. It's shocking in a way. And so in that sense, I feel like my book is telling a certain kind of story that's very contemporary, even though, part of the book is taking place in the 19th and early 20th century.
Pandemic, I read Alexander Dumas. I think is it called The Plague? I don't recall the name of the book, but I was also so stricken by like how similar the experience seemed. And we're talking about hundreds of years apart. It was really intense as well. So I definitely feel what you're saying there. So you claim that while Bom Retiro may not be the world, it explains much of the world, and I thought that was a fantastic sentence. So how is that so? Why do you think it's not the world, but it explains a lot of the world?
So, I mean, like basically all historians, we our research tends to be very deep and to focus on what's unique about places, right? And of course, my research is like that. So in that sense, I'm I'm not saying that if a person from Bom Retiro is dropped into the center of Toronto, like they'll be like, oh yes, I'm home. Like obviously, the language is different and the food is different and how people talk to each other is different and all that, right? So in that sense, I'm not claiming that there aren't distinctions. There are obviously distinctions. It would be ridiculous to say otherwise. But I am arguing that Bom Retiro is the world in the sense that there are things happening there about labor, about healthcare, about the built environment that are similar to what's happening in other places. And that by looking at one place, we can understand ideas in a profound way that we can then apply to other places. I mean, for me, Bom Retiro worked really well because the neighborhood is relatively small. Its geography hasn't changed that much over the last 150 years. So, like, I was able to figure out, like, when I would go today to like a workshop, a textile workshop, I could kind of figure out geographically what had been on that same location 50 years ago, 100 years ago, 150 years ago. That's often really hard to do in big cities where everything changes. Um, like in the part of Sao Paulo where I live, I mean, the street I live on, there was no street here 150 years ago. It was a farm or something like that, right? Even though today it's considered, you know, like an urban neighborhood. But Bom Retiro, it's a little bit different. Bom Retiro, like I could look at particular streets over long periods of time or buildings over long periods of time. And so that allows me to see things about health, about immigration, very, very clearly, and then ask the question, oh, is this like Barcelona? Oh, is this like, you know, I don't know, Copenhagen? Is this like uh, uh, Buenos Aires? And so that's my argument is that even though I'm not, I mean, it would be ridiculous to claim that everything's exactly the same. I mean, it's obviously not. But I am trying to say that we can look at individual places, think about more than just those places. And that is something historians don't always do. And it's something that people in public health do all the time. But my argument is they could do it better if they looked at more than just health statistics, right? That if people in public health were focused more on culture and on humans, their arguments, their broad arguments would be even more powerful, and perhaps help more people.
That makes a lot of sense. And I'm sorry to say that because I've enjoyed this conversation very much, but we are coming to the end of this interview. Is there anything else you'd like to share with our listeners? Perhaps, how can people get a hold of your book or how can they contact you if they have any questions or research related topics to discuss?
Sure. So I think the number one thing I'd like to say is how important Fulbright has been to me in not only writing this book, but actually in all my books. And not only has Fulbright been important, like for funding the research, but because I developed such a wonderful relationship with the Fulbright Commission here in Brazil. Even when I'm not in Brazil as a Fulbrighter, I feel like a Fulbrighter. And that's that's really wonderful. So the number one thing I want to encourage listeners, although I guess most are Fulbright alumni already, is apply for another Fulbright. Tell your children to apply for Fulbrights. Tell your students to apply for Fulbrights because for me, it it was life-changing and continues to play a huge role in my intellectual life. And so that's number one. The second thing I'd like to say is that I've been very fortunate that this book, which is available in both English and Portuguese, has received funding from the Mellon Foundation and is available open access in both English and in Portuguese. So, so if there are people who feel they can't afford to purchase a book, certainly here in Brazil, that's like everybody I work with at the health clinic, none of them can purchase a book. Um, it's really inspiring for me that it's going to be available or is available at no charge for people to download. Um, and that, as I hope this interview has made clear, uh, even though I'm a nerd, I've written this book in a way that I think anybody can read it. I've really tried to avoid big words. I've really tried to be honest about where I am in the story, including in very weird moments. And so I think that sometimes, at least for me, I'm often scared to read academic books because I'm afraid I won't understand them. But I hope people will give this book a chance because um, I think as academic books go, it's pretty straightforward and readable.
Absolutely. I totally agree. And I read it in one day. So I'm sure that you've accomplished that mission. It was really interesting reading. And not, not academic language at all. I felt I'm also a writer. So I take, I look at these things in detail and I kind of analyze it. And I felt, this is a very well written book. It's a very interesting. And like you said, although you're talking about a neighborhood in São Paulo, you're also talking about the world in general in a way. So I think it's fantastic. Thank you very much, Jeffrey. I really appreciate it. I will try to get the links for the book and leave them on the podcast description so that people can download them. And thank you very much for taking the time. I really wish you the best with the research anywhere you go. I hope to see you on other Fulbright Awards and to read your future books as well. Thank you. And yeah, I will see all of the listeners next time. So I hope you enjoyed it.
Thank you. Bye bye.
Bye bye.